After the baby comes out, the placenta needs to come out too, and that bit's called the third stage of labour often. And the way the placenta comes out naturally is that after the baby's born, the mother has a really big surge of oxytocin. Michelle O'Don talks about this and how that surge of oxytocin is the biggest one she'll have in her whole life. It's bigger than orgasm. It's just a really important big rush of that hormone that helps the contraction of the uterus, which helps to stop the placenta being attached to the wall of the uterus, and it just tends to fall down into the top of the vagina and be a bit of a full feeling, and then with the next contraction the woman will just generally get an urge to push it out. And pushing that bit out is relatively easy. The placenta's got no bones in it. It's a very full feeling but a huge relief when it's out. And in hospitals they tend to actively manage the placenta, although they don't always do that. And so to actively manage it, the midwife or the doctor will give an injection of artificial version of oxytocin, and it will make the uterus contract, and then the midwife or the doctor will just pull the placenta out. It's your decision whether you have a natural birth of a placenta or an actively managed one. The benefits of the active managed one is that it's over and done with really quickly, but the disadvantage is that that injection hurts like any injection does, but it can also make quite a lot of women sick. And so instead of having that first hour of skin to skin and bonding, the woman can be having to hand the baby to somebody else while she reaches for the vomit bowl. So good to avoid that if you can. Also, if you've had a natural start to the labour and a natural birth, then a natural birth of the placenta is the logical conclusion to that. But if you've had an actively managed birth, for example, if you've had a drip to make the contractions happen, or you've had an epidural anaesthesia, then it's the logical thing to have an actively managed third stage as well. The blood loss tends to be a bit more at the time if you have a natural birth of the placenta, and less as the days go on afterwards. And with the active management there tends to be less blood loss at the time, and then a bit more as the days go on. Overall it's similar amounts of blood loss. If you have a natural birth of the placenta and you do start to bleed, then you will be given the injection generally anyway, because that's just helping to control the situation with the bleeding. Or if you've been actively trying to get your placenta out for an hour, so if it doesn't come by itself in half an hour or so, we might encourage you to be upright, maybe sitting on a birth stool and emptying your bladder. Those kinds of things tend to help with a bit of gravity. But if it doesn't come after an hour, then the recommendation is generally to give an injection to deliver the placenta, but that's your choice. One thing I say about that is that dads all have, or birth partners tend to have, this hormone as well, which I don't know what it's called, but it makes them, the minute the baby's born, want to phone somebody. And I would really encourage you not to phone anybody, because it's really good to keep the energy as described to promote the release of oxytocin. So if the lights are low, the voices are soft, the environment's comfortable, and you're really focused on what's going on, then it encourages that oxytocin to just do its job and get that placenta out. Whereas if you open out to the world and proclaim the birth of your child, then you quite often are introducing a bit of adrenaline or other sorts of hormones into the mix, which might just inhibit that placenta coming out by itself. So just try to think of it as not being over until it's over. I'd really encourage you to not surround yourself with too many visitors either side of having the baby. So especially you first-time mums are very often at high risk of uninvited mothers and mothers-in-law coming to the birth, who might not be in your birth plan and you might not have thought about it. But we do often have to deal with relatives and friends who turn up and actually they're not what the couple wants, especially once they're in the active phase of labour. So try to just be aware of who might be thinking that they might be invited, and just have that little chat with them beforehand so that you don't have those awkward moments to deal with. But if you do, then talk to whoever's looking after you, the midwives, and they can help you to tactfully guide them elsewhere. After you've had the baby, that first hour is so important to have the baby in skin-to-skin contact with you. It's really good for helping to change to regulate the baby's heartbeat as the baby makes the changes from getting the oxygen from the placenta to having the lungs expanded and breathing from the air. It's a big change for the baby, and there's structural changes that happen inside the baby where the heart's getting just some changes to deal with a different way of getting oxygen. So holding baby close to you in skin to skin keeps baby at the perfect temperature, helps to regulate that heartbeat, and it also helps mum and baby to learn what those first feeding cues are. So try to do whatever you can to protect that first hour. It can be longer than an hour. The recommendation is that you have skin to skin for at least an hour, or until the end of the first feed, or for as long as you want to have it. So try not to let anybody interrupt that, because if the baby's being handed around relatives that have come to visit, then you're going to miss that time when the baby's looking for the nipple. So yeah, I would encourage you not to. And the other thing is to perhaps turn the phone off, so that's not a constant distraction. Sometimes people might put it on Facebook that they're going into wherever to have their baby, and they might still be in the latent phase 4 days later, reading 500 "have you had it yet" texts, and it's a stress that you could really do without. So try to keep yourself to yourself and not give yourself the added pressure of lots of people. It's nice to have people caring about you, but when they're on the phone all the time, it gets a bit difficult, a bit of a distraction that it can be nice to avoid sometimes. So try to think carefully about when you're going to announce when you're in labour, or preferably not, or when you've had the baby, just to try and protect your space a little bit. And the same when you come home, you need a bit of time to yourself, a little baby moon where you're not having too many interruptions from visitors. Or maybe you can encourage the visitors to bring you meals and not just come and take up all your time. And I don't mean to be mean, but it's just very important for you to spend some time together as a family, just to adjust to what's happened and get used to caring for each other.